Welcome everyone, Dr. Lindner. This is our last and final video on tissues. Remember, there is epithelial tissue, connective tissue, muscle tissue, and nerve tissue. And now that we've covered all of the tissues, we cover the skin next, which is part of the integumentary system. And the reason why the skin is the perfect system to get into next is because it's composed of all four types of tissues. It is made up of connective tissue, it's made up of epithelium, it's made up of nerve tissue, and muscle tissue. And let's see if we can show you where all of these structures are. If you look on the right-hand side, we're going to have our answer key. So what I want you to look at is numbers 2 through number 7. So 2 to 7, which is going from here to here. See if I can blow that up a little bit, make it a little larger here. So everything from here to here is the epidermis. And the epidermis is made up of a few layers that have the term stratum in it. Stratum corneum, stratum lucidum, stratum granulosum, stratum basal, and the stratum germinativum, sometimes called the stratum basal layer. And a little mnemonic, a silly mnemonic to remember these is Cher loves getting skin Botox. Cher loves getting skin Botox. Okay. Now, this is not poking at anyone. Cher is a, pretty old school singer and actress, and she's been pretty outspoken about Botox and plastic surgery over the years, because I think she's in her maybe mid to late 70s, but doesn't look it. So Cher loves getting skin Botox. In order from superficial to deep, the layers that make up the epidermis are the stratum corneum, stratum lucidum, stratum granulosum, stratum spinosum, and then the stratum basal layer. Cher loves getting skin Botox. Now, sometimes the stratum basal layer is also called the stratum germinativum, and that's because it's the germinative layer down here at the bottom that has stem cells. And you heard me talk about how it takes 4 weeks for the cells to go from the bottom layer all the way to the stratum corneum on top, where it's made up of dead cells that slough off, which is why you change your bedding, because every few weeks, those cells, the stratum corneum, is going to end up on your bedding and your pillowcases, and there's bacteria on them. So you really want to make sure that you change the sheets and wash them well. So let's look at the 3 layers of skin, generally speaking: epidermis, dermis, and subcutaneous, Roman numeral 1, 2, and 3. So if we scroll over to the left side, you'll see Roman numeral 1, Roman numeral 2, and Roman numeral 3. So 1, from here to here, this is the epidermis. The dermis is going from here to here. There's lots of structures that lie here in the dermis. And then the hypodermis, or the subcutaneous, is this deeper layer down here at the bottom, where we see these yellow fat cells and some of these receptors down here at the bottom. Okay, so epidermis, dermis, and subcutaneous or hypodermis are the 3 main layers of the skin. What we covered just before were the 5 layers of the epidermis. Okay. Now, the thick skin, like areas of your palm, which is thicker skin, the areas of your sole, they're going to have all 5 layers, 1, 2, 3, 4, and 5. The areas of the body that have thinner skin do not have layer 3. The stratum lucid, the clear layer, the lucid layer, is not found in areas where you have thinner skin, only areas of the body where you have thicker skin, like the palms of the hand and the soles of the feet. The stratum corneum has dead layers that slough off, and this stratum corneum up here is like 25 to 30 layers of stratified squamous epithelium. Stratified squamous epithelium. Okay, let's look down here at the dermis layer, which is everything down in here. Number 8 is the papillary region, which is more superficial. It's the top portion. And the deeper portion is number 10, which is called the reticular layer. So although the epidermis has 5 microscopic layers, the dermis only has 2. The superficial top portion is the papillary region. And then the deeper portion is the reticular layer, number 10. Now we have a bunch of things that we can find within the dermis. Let's take a look at some of those structures. Now, first I want you to see that what we see here is the same thing that we see here. Okay, what we see here and what we see here are identical. They are the same, except here is a cut section so we can see what's a little bit deeper. So what we see here, this structure is an oil gland, but we don't necessarily call it an oil gland. It has to have a more sophisticated name. And let's see if we can find it here. There it is. Number 22 is the sebaceous gland. The sebaceous gland, number 22, which is here, produces oil. And these oil secretions are going to move up the hair shaft and create this watertight seal around the shaft of the hair. Okay, so number 22 is an oil gland or a sebaceous gland. This white one here, which is the same as this one here, which is the same as this one here, this is a sweat gland. So we don't call it a sweat gland. We have another name for it called a sudiferous gland. So a sweat gland is known as a sudiferous gland, whereas an oil gland is called a sebaceous gland. Number 9, you see it's called a sudiferous duct. So this is the sudiferous gland. Number 9 is the sudiferous duct. Number 1, right here, and here, and here, these are called Meissner's corpuscles. Meissner's corpuscles are designed for light touch. Like if someone taps you on the shoulder and you know that someone just tapped you on the shoulder, it's this Meissner's corpuscle that's responsible for that. Now that is different than number 12, which is much deeper. That's called a Pacinian corpuscle. A Pacinian corpuscle is for deep pressure. And notice it's deeper in the subcutaneous. Right? That's the difference between someone punching you or poking you hard. That's the Pacinian corpuscle. Here, let's look at number 20, this structure here, which is the same as this structure here. This is muscle, right? So muscle, in this case, it's smooth muscle. If we look at number 20, that's called the Erector Pili muscle. The Erector Pili muscle, when this contracts, it's going to contract and tug and make your hair stand on end. It's going to give you the goosebumps. These here are free nerve endings. These free nerve endings are for touch and pain and temperature, right? So like if something touches you, you know it's hot or too cold, you can pull away. So these are free nerve endings. This is the Meissner's corpuscle, and this is the Pacinian corpuscle. So what have we seen here so far? And we have fat. Look at the yellow. We've got fat down here at the bottom in the subcutaneous. So fat is connective tissue. We have blood vessels. We have arterioles and venules, arteries and veins and blood. That's liquid connective tissue. We have Pacinian corpuscles and Meissner's corpuscles and free nerve endings. That's nerve tissue. We've seen epithelium on top. So you got epithelium. We've got connective, arteries, veins, and fat. That's connective tissue. We have muscle, which is the Erector Pili muscle. So the skin has 4 different types of tissue, which is why we cover it. Okay, if we look at this one, similar structures, 1, 2, and 3. Roman numeral 1 is the epidermis, 2 is the dermis, and 3 is the hypodermis. Number 1 is the sebaceous gland, which is this. This structure here is the sudiferous gland or the sweat gland. This structure here is the Erector Pili. Number 5 at the top, that's the Meissner's corpuscle. Number 7 down in the subcutaneous, that's the Pacinian corpuscle. Number 14 at the bottom, this is adipose or adipocytes or fat cells. When you look at number 25, 24, 23, 22, right? This whole layer looks like everything from 20 to 25. That's where you're going to see the stratum layers. So we have the stratum germinativum or the stratum basal layer, the stratum granulosum, lucidum, corneum, the stratum basal, stratum spinosum. Just remember the mnemonic. Cher loves getting skin Botox. So in order, corneum is at top, then lucidum, then granulosum, then spinosum, and then the basal layer, which is the stratum basal or the stratum germinativum, number 20 and 22, right? So here's 20 and here's 22. That's really this bottom layer right here, okay? So you should practice, review those. I'm not going to ask you too much about, you know, the hair follicle and the hair root. To me, just to know, right, this is the shaft of the hair. Here's the sebaceous gland. Here's the Erector Pili. I'm not going to ask you about the hair bulb or the medulla or the cortex. That's really too intrinsic for my purposes. Okay.